Your SI joints or sacroiliac joints are two long joints on either side of your low back that join your pelvic bone to your spine. They essentially rock backwards and forwards as you walk and as you run and are essential for the proper functioning of your low back. Pain in this joint will typically be felt over the two little bumps you can feel on either side of your low back that can go down the buttock or down the back of the thigh slightly. Pain can also be felt in the groin or the front of the hip. In this video, I'm going to show you one of the most common things that people do every day that is damaging and causing pain in this joint. So let's get started. One of the most common things that people do in their everyday to put stress and strain on these SI joints is crossing the legs. Crossing the legs is a problem if it's done over a long period of time because it puts a micro trauma into these joints in the same way that posture, a poor posture, can cause damage to the spine in very small ways but built up over a period of time, over months and years, can cause damage to the joints in the spine. Crossing the legs can do the same thing, but mainly in these SI joints. What happens when you cross your legs as you put your foot onto your opposite knee is that you are externally rotating your hip joint, which basically takes your SI joint out of its neutral position. If you hold this position for a long period of time, you can end up stressing and stretching the joint capsule as well as the surrounding ligaments of this joint. If this is sustained over a long period of time, you can end up stretching this area and causing an imbalance. This can cause it to become lax and loose, which can make it more unstable. What also tends to happen is that you get an imbalance in the surrounding muscles of your hip. Because you're putting your hip into an externally rotated position, you're going to be stretching your internal rotators and you're going to be shortening your external rotators. If you hold this position for long periods of time and do this repetitively, you're going to teach the joint to keep that joint in that position. Your internal rotators are essentially going to get longer and longer as the more that they are stretched, and your external rotators are going to get shorter the more that they are shortened. The body is very good at adapting to the position that you put yourself in. So the more that your hip is in that position, the more that it is going to get used to and adapt to that particular position. So you're going to cause this muscle imbalance, this instability in this area, and that's going to cause a problem particularly to the SI joints and also to the surrounding areas. Because if you get a problem in one area, such as the SI joint, you can get a problem in all the areas in the spine that rely on the proper functioning of that SI joint. Now the problem is that crossing legs for most people becomes a habit and can be quite hard to get out of. So if you do get problems in your back, particularly around this SI joint in the areas that I spoke of, this will be one of the things I would suggest taking out of your day. Try to keep your legs in neutral. This will reduce the stress around the SI joint and over time should make you feel better. Doing this for very short periods of time infrequently shouldn't cause a problem. But again, the problem is going to be when it's done repetitively over a long period of time, months and years. That's when we tend to get problems. So let me know what your thoughts are in the comments. Like this video if you found some value from it, and I will see you on the next one.